You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that had, has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and share it with friends. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. And I have Louise Short. She's the National Clinic Director of Strategic BA. They're owned by, I believe, Brown & Brown is their parent company. So, Louise, thanks for coming. How are you doing today?
I'm doing great, thank you. How about you, Richard?
Yeah, I'm glad to talk to you. So tell me about Strategic BA. What's the premise of the company?
Yeah, great. So happy to. Strategic Benefit Advisors is really a boutique health and benefits brokerage and consulting firm. We are located in Southborough, Mass, and our book of business is mostly in the Northeast. We are part of Brown & Brown, which is a $2 billion company in the property and casualty and employee benefit space. And as a company, the larger Brown & Brown, we provide employee benefit brokerage and consulting services to all markets. So from less than 50 employees up to jumbo employers, including the largest Fortune 100 companies in the country. And I'm currently working to build out a national practice of clinicians and well-being specialists, and we're focused on population health. So we're assisting employers in improving health outcomes, member experience, process of care, medical costs, productivity. We also have a new health innovation hub, and we're currently accumulating a lot of knowledge on digital health solutions in several categories, and figuring out how we can best help our clients understand that space and really leverage some of these solutions in their strategies. And we recently became a member of the National Business Group on Health Innovation Forum.
So, all right, for employers, what kind of issues are they facing, and how are these changing, in the last 10 or so years? What are you noticing?
Yeah, so employers are facing escalating healthcare costs at a rapid rate. And for every employer, the pain points are kind of similar. Varies a little bit by employer size and by industry, but what we're finding is high-cost claimants are a big concern. The cost of specialty pharmacy drugs, the ability to engage employees in anything, including work or health or anything in the workplace, is a huge challenge for them. The war for talent, very big, especially in certain sectors like healthcare and tech. And then chronic disease, which is really just kind of escalating these healthcare costs and literally, killing the American workforce. So the idea of digital health is really, and then I guess I didn't mention access is also a very big issue. So the idea of digital health is to address a lot of the pain points that employers have today. And digital health is doing that in a few ways. One is it's addressing access and availability of healthcare. The second is it's addressing high cost and chronic conditions. And then the third is it's addressing employee engagement and through different sort of modalities, programs, and emphasis.
All right. So what does that mean?
what does accessibility mean inside of a healthcare plan? What things are accessible or not accessible, and what gets in the way of people getting the healthcare they need when they're in an employer's plan?
Yep, great question. So we know today that there is an access issue. By 2025, there's going to be a 250,000 nurse shortage and a 90,000 physician shortage. And so even today, we have long waits for primary care, behavioral health, and specialists. And so in order to solve for that problem, digital health has enabled telemedicine. That's one of the sort of biggest manifestations of digital health. And so what we're seeing now are a lot of virtual visits, and that has increased the scalability and access to care. And initially, the virtual visits started off as being more like, I'll call it semi-urgent care, like I've got a cold, I've got a sore throat, I've got a cough, something like that. What we're seeing now is the evolution of virtual care and greater acceptance and utilization of virtual care, both by physicians as well as by patients. So what's happened, or I'll call them consumers because I'm going to really call them patients today. But what's happening is we're seeing virtual care move now into behavioral health, not just for consults, but for ongoing therapy. We're seeing virtual physical therapy, and I believe soon it's coming. We will see virtual chronic care. And, I was at a conference where it was kind of futuristic, but I really think it's coming around the corner. A woman was watching a soap opera, and her doctor interrupted and said, "Sorry to interrupt your programming, but I just need to ask you these 5 questions and check to see if you're taking your medications." That actually is going to start happening. I mean, it's already happening in some sense, and it's going to start happening a lot more. So that access is expanding tremendously. And we know the uptake by physicians of telemedicine has increased 340% from 2015 to 2019. So, and there's some early studies showing that virtual care is actually getting better outcomes for people with chronic disease. Intermountain Healthcare and some other organizations have done some recent studies. So I think there's starting to be evidence that virtual care is going to be more and more the way that consumers are going to relate to care. There have also been studies on consumer behavior, particularly Deloitte does a study every year, and what they've found is that millennials and Generation Z expect to be interacting virtually or with tech-enabled practices, meaning online scheduling, e-prescribing, being able to text back and forth or interact in an app and not having to come in to get things like lab values and things like that. So what we're seeing is that the younger generations are demanding virtual care or virtually enabled care, and that they're going to go more for the convenience care. Their expectations of the primary care relationship is also very different from older generations. They're not so interested in that long-term relationship as much as getting their care when they need it, how they need it, and kind of being done with it.
Well, if you have a chronic condition, that kind of runs counterintuitive to being done with it, because if you have a chronic condition, you need regular care, I would think, and a follow-up in order to manage the condition better than you normally would. So I don't know if that's a schism in the thinking. What have you found?
You're absolutely right. So if someone has a chronic condition, they're going to need ongoing care. But again, that ongoing care could be delivered virtually. And so it's like not having to leave work, even if you work at home or work in an office, go to the doctor's office, wait there. I mean, it could be a half a day or a day or more. If you have a chronic condition, many different appointments with specialists, but instead being able to do virtual visits from your home with a variety of different practitioners or from your workplace in a secure area. So there's just a different way of thinking about it. They don't need to necessarily be there hands-on in front of the doctor.
Yeah, from what I understand with telemedicine, you have to visit the practitioner in person the first time, and then you have, like a year to be able to do telemedicine or virtual conferencing with them?
I'm not sure what you're referring to. I mean, as far as I understand, you can always go back to, have another encounter with the physician. If that telemedicine benefit is provided through your healthcare plan, you can always, have another encounter. So is there some specific program you're referring to?
No, I know you can do as much telemedicine follow-up as you want. I just thought the first time you see somebody that you have to see them in person, and after that, you're able to do telemedicine visits. I didn't know if right off the bat you could just, all right, I need to see an endocrinologist, and the first time I ever interact with them, it's through telemedicine and not in person.
It kind of depends on how the program is set up. So if it's, for example, a sub-urgent care, like I got a sore throat or something like that, you can just, do telemedicine. Some physicians who are specialists or deal with more chronic patients aren't going to see you the first time in telemedicine. You're right. So it just kind of depends on what condition you have and the provider group that you're interacting with.
Okay.
But what's interesting today also is that there's chatbots, and that there are a couple of companies that are using chatbots to actually refer people into the right type of care. So you can go on, chat with the chatbot, which is programmed, has clinical algorithms behind it, and it will kind of direct you to the right care for your first encounter in the healthcare system. Like, suggest you see, go to the ER right away, or sounds like you need to see an endocrinologist. Here's where you can go. So there's interesting sort of access points, if you will, some of which are more automated.
All right, so access, I see, would be, a big benefit would be telemedicine, doing things virtually, texting, that kind of thing. What about the care itself? Is there any way to get better outcomes, using all the technology from digital health versus the way it's done now? Or is that not really a part of digital health's mission?
It definitely is. And I think what digital health is enabling and will enable more is more remote monitoring and also more use of social connectedness to change behaviors. I'll give you an example. The Diabetes Prevention Program, which is a program that is scientifically proven to prevent people from progressing from prediabetes to diabetes, 57% decrease in risk if you can change modifiable risk factors. Basically, people who are overweight or have high blood pressure and or high cholesterol and high glucose. So this program was always delivered brick and mortar. The YMCA had a national program where they would deliver classes in the diabetes prevention program. Probably about 10 years ago, a group of smart people got together and said, how can we scale this better and deliver it to more people? And they decided to put it on a platform, a digital platform, and have virtual coaching in groups. And what they found was that this virtual diabetes prevention program actually was incredibly effective. And they have shown and demonstrated amazing outcomes in terms of weight loss, reversal of metabolic syndrome, and they even have a government contract now to deliver this. And there have been a lot of other programs using the diabetes prevention program that have come up that utilize the same principle. So there are 3 or 4 companies that are doing this now. But that is an example of getting better outcomes, leveraging science, because we know the diabetes prevention program works, and technology and social connectedness in these virtual coaching groups.
So you said there's virtual coaching groups for what? For people that are dealing with diabetes or other chronic conditions?
Yes, prediabetes and other chronic conditions, hypertension and others. Mm-hmm.
How does that work with, are they led by a physician or are they just peer-to-peer groups? And how are people able to connect, without violating HIPAA?
Yes. So generally, it kind of depends on which company and which program, but generally these are led by trained coaches who usually have some kind of degree. It might be an exercise physiologist, a nutritionist, whatever, depending on the clinical condition. And they're able to do it by not violating HIPAA because they have everybody sign the appropriate releases, all of their technologies, HIPAA compliant, they have all the certifications that they need, and people agree to be in these virtual coaching groups. Yeah, a lot of times people can opt. They can say, I want to work one-on-one with a coach, or I want to work in a group. I want to work in a group, but I don't want to show my identity, so I just want to be anonymous in the group, or they can actually be in the group and have their identity known. It's totally up to the individual.
So how do the health insurers themselves and the employers, how they react to the new demands of digital health and, the benefits and the trade-offs? what's the feedback from them?
So really good question. So I guess I'll start with employers. So employers are kind of confused. There are literally hundreds of these different digital solutions, maybe thousands at this point, and there's new ones coming up every day, and they're in every clinical area: behavioral health, women's health, advocacy and navigation, helping people get around the healthcare system, diagnosis of disease, genomics, 23andMe, and all of those kinds of companies, virtual care, you name it, it's got a solution today. And so some of these digital solutions started out direct to consumer, and some still have direct to consumer apps, but they've expanded their services through employer-sponsored programs. So the challenge for employers is kind of making sense of this landscape, and that's part of what we do as consultants. That's what Strategic Benefit Advisors does. It's a very complex market, and so we encourage our employers that we work with to really look at these digital health solutions in the context of their broader workforce strategy, not just their health strategy, but their workforce strategy. So how do digital solutions fit in with their overall business objectives and goals, particularly related to health and performance and well-being? And so, employers need to look at their data on medical cost drivers, chronic conditions, employee talent and turnover and satisfaction, and figure out where is it that they want to invest and what makes sense for them, where will they get an ROI in their business, and then also what resources do they have. If it's a small employer and they're fully insured, they're not going to be able to probably implement a lot of these solutions. If they're self-insured, they've got more options, but still if they're a smaller employer, it will be hard from an administrative point of view to manage all of these different vendors. They may not have a lot of staff to do that, and it takes a lot of internal resources to manage vendors. So, they have to figure out what's right for them. And then when you implement these digital health solutions, which we tend in the industry to call point solutions, they have to figure out how to integrate it with their benefit strategy and other parts of their health management program. For example, if they have a care management program, let's say with a carrier, and they've implemented a behavioral health solution, let's just say they implement some kind of a cognitive behavioral therapy online, their carrier needs to know that they can refer people to that solution. So it all has to be integrated and work together. And that's really, really important because I've seen a lot of employers implement great solutions, but no one ever uses them. No one is engaged and they don't know about it. They don't know about it at the right point in time. So there's a lot of communications and integration efforts that need to go along with these solutions. So I think in general, the majority of the employers, and this has been shown, there was a survey last year by the National Business Group on Health and the Blue Cross Blue Shield Association, majority of employers want these digital health point solutions that have proven to be effective in the marketplace. They want data, which I'll talk about in a minute because there isn't that much data. The payment mechanism is important. So some of these solutions are like a PM basis. And most employers now are saying, no, I want to pay for this through my medical claims. They want these vendors to get set up so that they can be paid in that way. And then so they have to have a code, and that code needs to be reimbursed on the claim side. Or they want to pay for performance. If you engage a certain number of people, if you get certain outcomes, then we'll pay you X. So these are some of the issues for employers. They also struggle to integrate some of these solutions from an IT perspective, and they want to be sure that they have the right messaging, analytics, whatever it is, multimodal communication channels to actually, that the vendor does to actually kind of target and engage people. So what we're finding is a lot of employers would rather go through their health plan because a lot of the health plans have figured out, they better catch up and partner with these digital point solutions so that they can add more value to their clients, because otherwise their business, the carrier's business, is getting chopped up. It's harder for them to work with these different solutions. It creates more work for their staff, more costs. So basically now in the last several years, all of the major carriers, which are called the BUCAs, so the Blues, the United Healthcare, Cigna, Aetna, they're all partnering with different point solutions. And the advantage to employers is they don't need to contract directly with the point solution. They don't need to negotiate. They don't need to integrate. So all that is done for them, but they can't customize with the point solution. So there's pluses and minuses to both approaches, and some of the carriers have just outright bought point solutions. Now, some of the carriers also, though, are building their own. For example, I mentioned the diabetes prevention program. Well, 2 or 3 of the major carriers are building their own digitalized program that's very similar. So they're also doing Me Too's, if you will, or trying to develop original solutions for, for which there aren't competitive point solutions out there. But it's hard to find that niche right now because almost every clinical area has a point solution.
Yeah, it's tough because if a carrier wants to do their own stuff and keep it in a walled garden, how are they supposed to participate when employers are looking to choose carriers and plans if they don't integrate? They have all their own stuff. I know it captures them once they're in with them, but I think it doesn't seem to serve anyone to do that. What is the most advanced, comprehensive, or most efficacious plan you've seen out there? What are some of the elements of it? I'm not asking you to name names, but what are some of the best plans you've seen out there? What do they have?
The health plans or the point solutions?
The health plans, because it's more expensive than the point solutions.
So I would say that the best top health plans have, in my mind, really they have virtual care options. Really, really critical. They have robust chronic disease management. I don't want to say disease management, but chronic disease care management, meaning longitudinal care management of members with chronic disease, really focused on those members, incorporating some elements of virtual monitoring, if you will. And then they have options for other types of programs that have to do with for example, diabetes monitoring and glucose monitoring or behavioral health. Some of the plans now actually are integrating with non-traditional partners. So Cigna just announced a partnership with Amazon Alexa, and one of the other big carriers did as well. And right now it's just like information, like Alexa can answer health questions. But to be honest, in the future, what's going to happen is that Alexa's going to be knowing the treatment plan. Alexa's going to be reminding people to take their medications, or Google, depending on, whatever the personal assistant is. There's going to be a lot in that space, and the health plans, I think, are getting out ahead in terms of partnering with those non-traditional groups that aren't necessarily point solutions.
What are some of the most interesting point solutions you've seen? Just curious as to what some of those would be.
Yeah, so I'll tell you what some of the best funded areas by venture capital have been. And this just to give you some perspective, in the past 7 years have been almost $30 billion in venture capital funding alone for digital health. And that does not include the Amazon, Google, Apples of the world. So it's a huge area. I think 10% of all VC funding in 2018 was going towards digital health solutions. And it's not leveled off. We thought we would see in 2018 that it had kind of, the funding had decreased, but actually increased in 2018. And what we found was there were $8.1 billion in funding in 2018 for digital health with 368 deals. So in terms of some of the more creative things that I think I've seen out in the marketplace or most important, a lot of the solutions are really aimed toward big cost drivers or significant issues in employer populations. And it makes sense because when you think about it, employers are covering a huge number of lives, right, in the United States. So what's happening is that a lot of the solutions are aimed there. Many of these solutions started out direct to consumer and realized very quickly, no, that's not where the market is. The market is the employer market. So if we look at what's driving medical costs, one of the big things driving medical costs is behavioral health. So 5% of claims, but up to 20 to 40% of spend can be related to behavioral health, particularly those people who have medical issues and behavioral health comorbidities. So what we've seen are, because there are a lot of access issues in behavioral health, we've seen virtual visits that started as consults and now is moving into ongoing therapy. We've seen also online cognitive behavioral therapy, peer support programs, new work-life support and EAP models, programs for families with autism and developmental disabilities, resilience training, and resiliency has become a big issue. It's about making sure that people have coping skills and getting to them before they get stressed out. So instead of stress management, it's like prevention of stress. So I think behavioral health has been one of the areas that's had sort of the biggest innovation in terms of the sort of intellectual capital and money that's gone in there. We're also seeing a lot of musculoskeletal solutions. So musculoskeletal drives a lot of costs for employers. Back pain, hip pain, knee pain. Many of those people do need some type of intervention, but many can be managed, at least initially, conservatively with physical therapy and other interventions. And so we're seeing virtual PT, where we have companies that have built devices that they send to members, and then the member can have a virtual visit with a physical therapist, and the physical therapist can monitor their motion. So I think that's really amazing, great solution. I mentioned the pre-diabetes. Those virtual coaching solutions have shown great results, sort of across the board, different groups, different companies, but all pretty good results. Women's health and infertility, that's been a big area and focus for employers in terms of retaining talent. And we've seen some carved-out solutions, meaning carved out from the health plan on infertility that are virtual, including new types of benefits that are administered, narrow networks, and quality monitoring, and coaching that includes behavioral health, because that's a very stressful time for people, but that have shown, cost savings, decreased multiples, which is really critical in terms of, decreasing risk to the individual as well as the babies, right? And then, of course, decreased costs if you don't have multiples, because people don't end up in the ICU as much and things like that. So those have been great solutions. I think for there are also a lot of solutions that apply only to this sort of provider side, right? Like teleradiology, telepathology, virtual monitoring of ICUs, all of those types of solutions, I think, have improved efficiency for physicians. There are solutions that are in the expert medical opinion area that I think are critically important, where people can get a second opinion or an expert opinion on what's going on with either themselves or a family member virtually. And these solutions, I think, are among the best that I've seen in the industry in terms of actually really helping people get high quality care and the best care. Many times the diagnosis is wrong or the treatment path isn't optimized, and so these types of solutions and vendors are able to help members tremendously. And then one of the central types of solutions that's come about in the last, I want to say, really 10 years is this whole idea of advocacy navigation, both digital and human. So using analytics to get people where they need to go, holding their hand through episodes of care, giving them, sort of personalized attention, very different than traditional health plan customer service, where they can understand what's going on and be helped to get the right care and the best care at the right time. So those are kind of a smorgasbord, but, again, addressing the problem of the healthcare system's too complex and people can't get to where they need to be, or they don't understand where they need to be, and that leads to, poorer outcomes, poorer quality of care. So, and I think these advocacy navigation solutions also address health literacy and helping to educate people and make them understand more what they're going through and what kinds of questions they should be asking, and educate them on the choices that they have going forward.
One last question for you. You've covered a lot of areas, but is there anything you haven't covered that is in the future of digital health? Any new exciting things that are coming? Again, I know you touched on a lot of things, but
yeah, I think that we're sort of at an inflection point. Every day new possibilities are opening up, and some are what I would call evolutionary. We haven't really talked about new therapies to cure disease because that's not really so much digital, although some of it is. And then, there's sort of new ways of doing things that have been done before, like my example of the diabetes prevention program. Some of it's improving with technology on what we already have, like ultrasound and imaging. But I think the thing that impresses me is that the pace and speed to market of innovation is unlike any era in the past. So what we're going to see, I think, is a lot more virtual care. When I was showing my daughter a photo about 10 years ago, my youngest daughter, and there was a record player in the photo, and she had no idea what the record player was. And to me, that's where we're going in medicine. I think 10 years from now or 20 years from now, when we show kids pictures of hospitals, they may not know what that is, because the idea of inpatient medicine is going to be reserved basically for people who are enormously ill or need some major surgical procedure, because a lot of the surgical procedures, even hip replacements, knee replacements, are being done outpatient now. It's amazing. So I think that we're really going to see a very big change in how healthcare is delivered and where it is delivered. It started already, and it's we're just at the brink of a very big, I think, evolution or maybe even a revolution in how that care is going to get delivered. I think we sort of live at, I'll call it an age of a mutating edge, but like not the cutting edge, but the mutating edge. Like things are changing, but not in a cancerous way, but they're changing radically. And we're pushing the envelope every single day. I think the other thing to think about also is that I've talked a lot about employers, and I am a consultant for employers, largely self-insured employers, but we need to see equality in the application of these solutions. Everybody in this country really needs to have a basic level of coverage that includes preventive services, and we need for everyone to have health literacy or be able to have access to all of these wonderful solutions and technologies that can improve the quality of care and health outcomes. We don't want this to be something that is only for those who can afford it, only for those who are employed. And many of these solutions now are being utilized by Medicare and Medicaid, and hopefully we'll see more of that as time goes on.
Well, very good. So what's the best way for people to get in touch and to find out about your services, whether they're an employer or a carrier, insurance company, et cetera?
Absolutely. So they can reach me at Louise, LOUISE, .short, SHORT, at strategicBA, like benefits advisors, .com.
Well, very good. So Louise, thanks for coming on the podcast. I appreciate it.
Thank you so much. I appreciate your having me today, and I'm delighted to be here, and I hope that I will hear from some of the people who listen to this podcast, because this is an area that I feel really passionate and excited about.
Excellent.
You're listening to the Future Tech Health Podcast with Richard Jacobs. Until I reached age 40, I never realized the obvious, that we all have medical issues, or we at least have a family member or close relation that has, or will have them in the future. Medicine and biological systems are the final frontier. Until we've conquered death, figured out how life began, cured cancer, and understood our purpose in the universe, there's a heck of a lot to talk about when it comes to our health. Future Tech Health means I'll be covering futuristic topics that are actually already in clinical trials, or even starting to appear on shelves or by prescription, or available for your own use. We dive deep into stem cells, CRISPR-Cas9, the science of sleep, epigenetics, medical testing, cancer, ketogenic diets, stem cells, aging, regenerative medicine, and more. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a serious medical problem. Remember, however, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoy the podcast, please listen, subscribe, like, and share it with friends. Thank you.